Crowns, dental crowns. When it comes to crowns, a lot of patients are confused what type of crowns to go in for. Crowns basically are two types. One is metal and another one is metal free. Metal has total metal and then metal which has ceramic on top of it, which is called as porcelain fused to metal. And the other one is zirconia, which has no metal in it and it's a different material altogether. So zirconia has certain indications, metal crowns meaning PFMs have certain indications. So in metal, whatever I was trying to tell you is PFM. There are two type of PFMs which are porcelain fused to metal. One is the regular porcelain fused to metal and the other one is, we call it as DMLS. DMLS is a porcelain crown which is milled by 3D printing. The metal is milled by 3D printing and the ceramic is added on top of it manually. The zirconia is 3D milled from starting and then finishing also is 3D milled only. So when do you go for zirconia? Especially when the zirconia is a front teeth, which zirconia gives absolutely good aesthetics, and even if it chips off, there is no metal which is seen behind. So does zirconia is only indicated for front tooth? No, it's also indicated for the back teeth. Some zirconias have high strength zirconia and some zirconias have medium strength. So we have to put a high strength zirconia for the back to withstand the forces. So zirconia is very strong, and if you have an opposing tooth which is weak, say suppose we are putting a crown in the bottom, and if you have a weak upper tooth, then we don't suggest zirconia here, because this tooth will damage this tooth very fast. If you're going for this tooth also zirconia at a later stage, yes, you can think of zirconia here. So either ways, both are good enough, and I would suggest don't go for plastic crowns, which is acrylic crowns for the front, can be given for temporary purposes but not for regular purposes. PFM or in between PFM and DMLS, I prefer DMLS. In between DMLS and zirconia, I prefer zirconia in ideal conditions. So when a patient grinds the teeth in the night, okay, or who has more biting forces, the top portion of the ceramic may chip off on both the sides. So in such cases, patients who are cosmetically very oriented, we cannot give them porcelain fused to metal. We have to give them zirconia. So do your research again, go back and then choose your crowns wisely. Usually I would still prefer a zirconia crown over the regular DMLS or a PFM crowns, wherever it is, because the technology is more advanced and it is more 3D printed. And also added to this, we call something earlier, we used to take physical impressions, meaning we used to make the tooth small to accommodate the crown. After making the tooth small, we call it as a crown preparation. We used to take a alginate impression or a putty impression, where we used to put, if all of you know, a little alginate which is like a bubble gum, and then put it into your mouth and then wait for it to set, then take it out and then send it to the laboratory. The laboratory, he used to pour the stone into this and then form a crown. So in this, the margin of error will be very high. It could be the shrinkage of alginate, or the model may expand and things like that, where the crowns will not fit well. Now what we have is latest is something called as a scanner, digital scanner. So when after you make the tooth small, we take series of pictures of that, meaning we scan the tooth and then we email the tooth to the laboratory in a particular format, and the lab will automatically feed it into the 3D printer and the 3D printed teeth will come. So here the margin of error is absolutely minimal, and the tooth hugs the crown very well, or the crown hugs the tooth very well. There is no food lodgement issues, even though if it is there, it is to the bare minimum. So 3D printed technologies have come, the scanners have come. Most of the clinics in Bangalore, I would suggest getting to the scanners. At least now the awareness is so high that many of the clinics in Bangalore, I am sure, have scanners with them. And this will give accurate crowns, whether it is an implant supported crown or just a tooth supported crown, a bridge or any such thing. So go in for a 3D printed scanner. It's slightly better than your regular impression. Thank you.